Hello, I'm Heather Knox and I'm the Chief Executive here in NHS Lanarkshire. Today I'm going to talk about COVID and our response. I'm also going to touch briefly on the flu delivery programme, and then I'm going to cover some detail around the tiering system that is now in place in terms of COVID across Scotland as a whole. So if I start off first of all talking about COVID, I know that this has been very difficult for staff and we've had to mobilise very quickly during this second wave. So I want to take this opportunity to thank all of you who have been involved in moving things around, turning wards from green to red during this difficult time. Equally, our teams within primary care and community services have, as always, risen to the challenge. I'm really pleased to say that our new case numbers have now started to come down, and we're hopeful that we're beginning to see a trend in that area. And today, for the first day, we've seen our inpatient numbers decrease. So it's early days, but we do think the measures that were taken some weeks ago are beginning to take hold. Secondly, I'd like to talk briefly about flu. Again, it's a big thank you because we're well on our way with our flu immunisation programme for the general public. You'll be aware there's been quite a lot of anxiety around flu this year because we are calling cohorts in a slightly different way from previously, and that's because we're vaccinating more people than ever before. But we are well on our way, and again, a lot of people have changed jobs, they've come to the fore and helped us to deliver this programme, so a big thank you again. Finally, I want to talk about the tiering system. You'll have heard on the news today that Lanarkshire will remain in Tier 3, which is very similar to the tier that we're in just now, so the measures will be broadly similar. I've worked very closely with my partner organisations over the last few days to provide a case for government in response to a request from them around whether we should be in Tier 3 or Tier 4. Now, some of you will be saying, well, we're struggling in the NHS, so we think we should be in Tier 4. So I want to explain to you a bit about how we came to that decision. Tier 4 brings with it a lot of economic disadvantages. A lot of people would be out of jobs if we moved to Tier 4. So there's a very real danger that we will exacerbate our local inequalities, and that can have health consequences too. So we need to think about that. The other thing that we considered around Tier 4 was the impact on shielding. We currently have many members of staff who would have to be shielded again. So again, that would have an impact on our workforce. In coming to the decision to support a Tier 3 recommendation, I considered very carefully with my team the workforce implications and the number of beds that we are likely to need over the next few weeks. Given that the numbers are, as I've just said, beginning to come down, I felt I could lend my support to not moving to Tier 4 at this point. I know some of you feel that we're overwhelmed within the health service at the moment, but I do feel the tide is beginning to turn. We will review this decision on a daily basis with Scottish Government, and if I feel that I need to change my mind, I absolutely will do so. I wanted to take today just to explain that to staff because I knew you will have some questions around that. Can I finish off by just saying again to each and every one of you, I do appreciate the time and effort you put in every day coming to work and looking after our patients. Thank you.